Thanks indeed, Kylie. A very harrowing picture of last year in Western Health before vaccines were available. Really unbelievable work from you and your team, and we really pay tribute to everything that you've done. And everything we're trying to do in public health is to protect our hospital system from just that scenario of overwhelming numbers needing community care, needing inpatient ward care, critical care, ICU. That is what all our efforts are focused on. Just in terms of the outbreak at the moment, of the local cases I can provide for the 52 that are linked thus far, 9 are linked to the Shepparton outbreak, 5 to the My Centre childcare setting, 5 to Altaqua, 3 to the City of Hobsons Bay outbreak, 2 to Glenroy West Primary, 2 linked to Sunshine Hospital Emergency Department, their household contacts, 2 linked to Chemist Warehouse in Hoppers Crossing, 1 linked to the broader Royal Melbourne Hospital outbreak, 1 to the Eastern Kilda community outbreak, 1 to Berkeley Square, 1 to CS Square, and 20 cases linked to existing cases, but those original cases don't have a known acquisition source. There are now more than 16,000 primary close contacts and more than 20,000 secondary close contacts. In terms of the location of our newly acquired cases, they're really focused with 7 in Brimbank, 15 in Hobsons Bay, 8 in Hume, 14 in Wyndham, and of course 9 in Shepparton today. Other suburbs though, or local government areas, Banyul, Boroondara, Darebin, Dandenong, Melbourne, Monash, Moreland, Port Phillip, Whittlesea and Yarra. So a really significant spread of cases still, but a lot of focus obviously in the west and north of metropolitan Melbourne and of course Shepparton. In terms of our active cases, and this is the story of vaccination and really points to a difference with 2020. 170 of our cases are aged 0 to 9, 124 aged 10 to 19, 167 are aged 20 to 29, and 150 are aged 30 to 39. So more than 3/4 under the age of 40. That is not the demographic spread of age in our community, to have fewer than 1/4 of cases over 40 years of age. That is the effect of vaccination. That is telling a really positive story. And as supply ramps up, as our GPs and pharmacies have Pfizer available from today, as our state vaccination hubs are doing more Pfizer vaccines, first and second dose, than ever before, as well as having plenty of AstraZeneca available for those eligible populations. These are really, really positive measures that will change the story of who we're seeing as cases and can provide us options as we go forward. In terms of the Shepparton outbreak, there were 2 mystery cases notified yesterday. They are now linked. All cases in Greater Shepparton are now linked in this outbreak. That's a good news story. A key call out, however, anyone who attended Sky Salon Hairdressing on August 15 through to August 19, we believe, please come forward for testing. We believe there are more people who need to come forward who might have been there over those days. The Traralgon exposure site that's been published, really no exceptionally high risk there. The close contact of the case is tested negative, but there are still potential exposures, so please be aware of that, but doesn't look like a high-risk exposure site at the moment. In summary, we're in a very challenging position right now. We are hoping to see a trend, and maybe it's stabilising over the last few days, with numbers not increasing exponentially. We are in a much, much better position than we might have been with exponential growth from the beginning of this outbreak. The number of days from when we had 50 cumulative cases in July is relatively flat compared to how it took off in New South Wales. That is both a tribute to everything that Victorians are doing in terms of following the rules and the fantastic work of our contact tracers. It still sees a really significant number linked, and manages those known and linked cases really effectively. But it's a huge effort required for the Delta variant, and it only takes us dropping our guard just a little bit for that transmission with the Delta variant to occur to household members and within the community. So really, really high levels of compliance, and they are hard to maintain. I accept doing the right thing all of the time in all circumstances is incredibly challenging, but that's what Delta demands of us if we're going to drive cases down. But contact tracing will do its efforts in identifying all of those close contacts and ensuring that there's support to people in isolation and quarantine. Most of the outbreak is under control, but for those areas that are seeing the mystery cases, in particular Hobsons Bay, Wyndham and Hume local government areas, we do see continued mystery cases amongst those other linked cases. That presents a challenge for all of us in terms of changing the restrictions going forward. We do see some reluctance still in people coming forward for testing. There'll be a myriad of concerns about whether your close family members, therefore need to be in quarantine, what that will mean for their work, what that will mean for their potential risk. But there is you can't have your head in the sand around this. If you are symptomatic and you might be infected with COVID, the only path for protecting your family, your loved ones, your close contacts is to get tested so that they can know at the earliest possible time and can protect those other family members, those other households, those other workplaces and places that they might go to if they know their status. If they know that they are primary close contacts and can quarantine, they will not put other people at risk. This is not about blaming anyone. This is about being clear that the only pathway to protect those around you, those you care about most, is to actually know your own status with regard to COVID-19. Visit the coronavirus.vic.gov.au website. There are links both for the exposure sites, but maybe more importantly for the financial support tab on the homepage. There's the disaster payment that you're probably aware of if you can't work due to the restrictions. That's up to $750 a week. There's the $450 payment for getting tested and awaiting your result if you have to miss work. There's the $1,500 isolation payment if you have to quarantine for that full 14-day period. And of course, there are the relief packages and the business support that's been available through the Victorian Government as well. If you need support, please call out for it. It is available. If you have symptoms, please get tested to protect those you love the most. If you don't have symptoms, please go to one of those vaccination settings, GP, pharmacy or one of our state hubs that are providing more vaccines than at any other point to give us those options that we are looking desperately for. Thank you.
Minister, Tony Blakely said on the ABC this morning.
But yeah, thank you.
I'll just add on vaccines.
Sure.
It really is our pathway out, and we've got a lot of bad news around Australia at the moment with respect to COVID, but AstraZeneca, there are signs that the immunity that you get from AstraZeneca might even be more long-lasting than Pfizer, and that it will outperform Pfizer 6 months after getting vaccinated. One of the other advantages in a rollout that's been slow across Australia in global terms is that we're getting our Pfizer doses in the middle of this Delta outbreak, and so the peak of protection from the Pfizer vaccine is going to happen when we've got really significant pressure of cases. That is good for us in terms of our population immunity. We just need to crack on and get to that 70-80% level, and there are good news stories around the world. Iceland, Denmark, Singapore, different countries, different demographics, but they've gotten to 90% of their 12-plus population, 90% plus. So 70% population coverage, and controlling Delta with that level of vaccination coverage and easing restrictions very substantially. That's where we're headed to. That's where we want to head to. And that is going to be available to us with the highest levels of vaccination coverage we can get. Sorry, Shannon.
Is your advice to government still that we need to get to zero, or is it to keep the numbers low as the National Cabinet strategy?
We have to do what is feasible. We are not going to we are not going to achieve the impossible if it becomes impossible. But the aggressive suppression strategy is pretty explicit through National Cabinet. It is doing your utmost to keep those numbers down, to manage the health system, to get to zero if you possibly can, but not with some absurd hope if numbers continue to increase despite everything that you're doing.
So in our current situation right now today, is zero possible?
I can't say. I know that we can do better in terms of all of the things that we're building as our public health response pillars: communication and engagement, the compliance with our restrictions, the testing and the vaccination coverage. They are all things that can help drive numbers down. We could do better in each and every area. We know that more people could come forward for AstraZeneca. We know that people could follow the public health restrictions even more strongly. We know that dropping our guard from time to time just gives Delta that opportunity to break through and cause another workplace, another family outbreak. So we can do better. We're stabilising. That is still a positive element in terms of having relatively low numbers in our ICU.
If it becomes apparent that zero is no longer an option, and I say this knowing that it didn't quite work last year, but with the added advantage of vaccination this year, do we look at specific rules for specific LGAs so that other people can enjoy freedoms? Is that on the table this year?
I wouldn't say it's off the table. I think we have to see how the virus is moving around. Clearly, we're doing pretty well in Shepparton. That gives options for regional Victoria in particular at the moment. Metropolitan Melbourne has exposure sites right across the metro area. I don't want to be in a situation where you drive people to leave certain LGAs to go to other LGAs and seed it more broadly. So we have to bear that in mind, how human behaviour responds to restrictions being in place or not being in place. But to the extent that we can apply things differentially, we've always tried to do that.
Yeah, what about the double vax though? What about people who would right now double vax before other people? Why can't they prove it with their passport or such and give them immediate freedoms now so that the economy can benefit, you know, mental health, all the rest? What's the reason why we can't do that for those people?
Well, this has been talked about and planned through National Cabinet for a long time. It's still being worked up. I don't want a situation where we've got differential rules in Victoria compared to New South Wales or South Australia with respect to doubly vaxxed people. It would be great to have national consistency for the issues of equity and for the issues of perceived fairness. But I think that there are reasons for doubly vaxxed people to have greater freedoms, greater accessibility for certain settings, but that's still being worked through.
Is the playground and the curfew under review this week? There are discussions about changes or extensions to restrictions. Is it all in, or is there some movement?
No, everything's up for review whenever we come to this point of reconsideration. Yeah, we'll look at that. We have to bear in mind that transmission can occur in all kinds of settings, but it's a balancing act. We want to make sure that people can sustain those behaviours. We want to make sure that mental health of adults and kids is supported to the fullest extent that we can within these awful constraints of lockdown that is supporting our health system and the health system response.
Is there any update on
Just to follow from that, sorry. Obviously, 18 months into this pandemic, it's a bit of a different landscape. So rather than driving cases down to zero, do we need to weigh up the mental health?
We've always weighed up the mental health issues. Part of the reason why the public health response has been what it's been is to get to a point where we can freely ease restrictions to allow people to live the lives that we know that we want to live as human beings. So all of that has been a primary consideration right through. It remains a consideration in everything that we are making determinations on going forward.
We're seeing more children present with mental health issues in this last period, you know the stats. So, you know, do we need to weigh that up rather than continuing to focus our eye on driving down?
It is not a question of just focusing driving transmission down. We are absolutely thinking of that. We are thinking of, at the same time, what the consequences of opening up too much would be, both for children's health, the long COVID considerations, what it means if they were to introduce the virus back to their families, what it would mean if transmission between children would be a real driver of, you know, the epidemic increasing really significantly. The 40,000 cases that are occurring every day in the UK at the moment in part is driven by the fact that there are unvaccinated kids because they're not yet eligible, or they haven't got the coverage of the 12-plus age group that they would like. In countries that have gotten to high coverage of the 12 to 15-year age group, they've gotten better control. There are, as I've pointed out before, there are literally millions of children orphaned by COVID. There are families in New South Wales at the moment who are struggling with one or both parents being hospitalised or dying. Those are mental health considerations for kids, as for all of us.
There are obviously a couple of restrictions that would be completely off the table, like, home gatherings, for example, or opening theatres or restaurants. What are some of the safe things that could potentially be eased, and what are they?
Look, we're working through those at the moment. There's nothing. There is nothing to announce today. Clearly, we've always said there are higher risk settings. The lower risk settings are those in which the gatherings are much smaller, where it is doubly vaccinated people who you expect, so the age groups that are eligible in that regard, in outdoor areas and where it's not prolonged contact, or where it's in a regulated environment where there's check-in, where there's an opportunity to be able to contact trace. So all of those things are in our mind in considering restrictions and easing of restrictions.
Yesterday, the Premier had said he had received...
Can't work at the moment, but we've got examples of mobile massagers that can go to people's homes and provide this service. Is there inconsistency there that perhaps if we are seeing a plateau in the numbers, we could open things like dog groomers? There's a lot of
these are things that would be under consideration if they are regarded as low risk. We have to think about whether transmission might occur, with compliant businesses or non-compliant businesses, because there's always a proportion. But you're right, where there are limited person-to-person interactions, they are the lowest risk settings. With respect to massage, it's not massage, it's critical medical support to people who need allied health intervention as an emergency or as something to relieve a really significant medical condition.
We could have dog groomers though last time around, and we can't this time. What's the difference?
Look, let's consider it as we go forward, but nothing to announce today.
Yesterday, the Premier had said that he had received medical advice just yesterday that we could essentially drive case numbers down to zero. Given it took us about 60 days to get from 100 to zero last year, with obviously a less virulent variant, and with the same restrictions in place, what makes us confident that we will be able to drive down cases the same way we did last year?
Look, I'm not talking about being confident or lacking confidence. I think we need to do our utmost, again, in line with the national strategy of aggressive suppression. We have got a different situation with respect to vaccination coverage for some of our most vulnerable populations, and indeed, our aged care sector, tragically last year, was not just settings where so many tragic deaths occurred. It was also a driver for transmission as those essential workers worked across facilities, took cases back to their families unknowingly. So it was also a driver of transmission that made last year particularly challenging. We've got a significant proportion of our workforce, of our aged care and health sectors that can be amplifying environments for transmission, highly vaccinated now. So that does change the dynamics. But I'm not second-guessing where we might be able to get to in 2 weeks, in a month. We will do our utmost, and we will try and balance all of those elements of what is a proportionate but necessary response to protect our health system.
Care, as part of National Cabinet decision-making, I guess, aged care workers need to have at least their first jab by September 17. That hasn't been, written into the public health orders, or there is no legal mechanism currently to mandate it in Victoria. Where are you up to with that?
It is absolutely on track. It is expected to be in place. We have communicated the expectation that the sector needs to ready its workforce to make sure that those who are attending and rostered for those shifts will be vaccinated by that deadline. So that's our expectation. That's what I would expect to see by mid-September.
And this is obviously a federal government responsibility, but do you know what the plan is if we still have a large chunk or even a small chunk of the aged care workforce not vaccinated by September 17? where's the surge workforce? How do we actually, how do people care for the elderly people in these homes?
Look, we've clearly flagged that at Age PPC as an issue. It's been brought up at health ministers' meetings, and maybe Minister Foley can speak to that. We have flagged it as a concern. The Commonwealth needs to manage that workforce that they've got responsibility for in private sector aged care. For the public sector aged care workforce, we've got very high vaccination coverage already, so the implications for the workforce, I think, are much less. But the risk is there. There will be some individuals who will choose not to be part of that workforce ongoing, so the planning needs to really happen at the facility level, but also at the organisational level for those networked aged care facilities that have a workforce that might move across.
Will Parilla Lodge
is that a close contact of someone who visited the shopping centre, or is that something you found historically?
I don't know the details. I imagine it's a close contact, so we're assigning it to the CS Square, but it won't be a new. I doubt whether it'll be a new exposure from one of the shops within that square.
And in terms of the western suburbs, where are you sort of seeing the transmission happening at the moment? Is it exposure sites? Is it workplaces? Where are you sort of seeing the areas you need to jump on?
Oh, look, it is those retail settings that remain open, so food. There'll be supermarkets as exposure sites, but some of those essential services like a pharmacy, food distribution centre, they are the places that have to remain open and do remain open, so they remain a risk for transmission. That's why wearing masks remains important. That's why getting tested immediately remains really critical.
And there was a Shepparton aged care facility, Echuca, aged care facility. It's been listed as an exposure site for about 13 days, but I think all the staff and residents have tested negative. Is that correct? Is there any risk there that we should?
Look, the determination of an exposure site tier is really for the local public health team to look at the risk and to take an appropriately precautionary approach. They don't want, by any means, transmission within an aged care facility. Those early tests of staff and residents is really good news that there hasn't been anyone tested positive. They still need to go through that quarantine period. They could still test positive, but it looks under control, and clearly there's been no transmission detected yet.
Just on Shepparton, it's doing well, as you said before. You sort of hinted that regional Victoria might get some sort of a reprieve. Are you planning that they might be the first to go and maybe fencing off Shepparton or keeping them, locked in, and the rest of the region where there is nothing?
Yeah, no immediate determination, but we would clearly look to whatever options we can in releasing restrictions for places where we don't see transmission. We don't think they're too substantially at risk because of the movement of people or because of exposure sites. And it's just good news that all cases are linked in Shepparton and that the public health response can wrap around those close contacts, of which there are thousands.
How close are you to making an announcement for even regional Victoria first or the rest of the state?
Look, it'll happen over the next couple of days.
Over the weekend, there was talk about Sunshine West and the industrial site and wastewater detections repeatedly coming up. Is there any update there, and is there anything specific happening in terms of testing of workforces there? Yeah,
we've tested at very high levels a number of workforces there focused on that area that the wastewater catchment represents. So 90+% coverage for those workforces. We haven't detected a positive case. It may be that someone has recovered, remains infectious in terms of excretion of virus in wastewater, but not testing positive on the nasopharyngeal swab. So that's a possibility. Nonetheless, they could have transmitted to others. There might still be people who have been exposed and are yet to become unwell. So we need to continue the call out for testing and for anyone symptomatic to come forward as well.
The Royal Melbourne Hospital's Aged Persons Mental Health Inpatient Unit at Broadmeadows Hospital has had 2 cases in the past week, and I understand there's also been a case at the Broadmeadows Hospital. What cluster are they linked to? Are they part of the Broadmeadows cluster or the Royal Melbourne cluster or something else completely different?
Yeah, I don't know for all of them. There are some that are clearly linked to the Royal Melbourne Hospital that were transfers across, but I don't know that applies to all of them.
Right.
Just one last question. Yesterday the Premier said people are presenting late with symptoms, and he said that anyone attending the protest isn't likely to come forward and get tested. Are you concerned that undetected cases are circulating in the community?
Yeah, of course. We always make the assumption that there are cases who are symptomatic, who are positive, who haven't yet come forward for a test. I can't say it enough that testing is the way to protect your family, your close contacts, your loved ones. It is also a mechanism to protect you if you are diagnosed early in an illness, and we've seen from the Delta variant, it's not just more transmissible. For those who are unvaccinated and for those who are vaccinated, if you compare the Delta variant to previous variants, you are more likely to be hospitalised, 2.7 times more likely to be hospitalised. What we're seeing internationally is that through this wave, there are much fewer cases relative to the number of overall cases. There are fewer cases being hospitalised. That's because of the high vaccination coverage. But for one individual who's vaccinated compared to previous variants, you're more likely to get severe illness. For any case who's unvaccinated, you're much more likely to get severe illness. So getting tested early is also a way to have access to appropriate treatment and care. And you may have heard of the Sotrovimab monoclonal antibody that is now available in Victoria. We've got a distribution plan for it. It'll probably be given to patients starting this week, if not tomorrow. And it works on neutralising the effect of the virus for people who are eligible and who are most at risk. So more elderly, people with chronic illnesses, people with immune conditions, people who haven't got the ability to respond to vaccination because of their immune system, as well as others might. So getting tested early means that you can have an early intervention with a monoclonal antibody like this, or some other medical intervention that can make a difference to your outcome, keep you out of hospital, and absolutely keep you out of ICU and keep you from dying. So can't say it enough. Get tested early to protect others, but also to give yourself the best chance of staying out of hospital.
Workers at the level crossing removal site at Edith Vale were yesterday told initially that it was a Tier 1 site. I understand a worker tested positive immediately after he'd spent 2 days working there. It was then downgraded to Tier 2. What was the basis for those upgradings and downgradings?
Well, you're following these exposure sites more closely than I am. That's very much in the weeds in terms of the public health response. I don't know the specifics. They always look at those sites. They understand the interactions of individuals. It may well be that a workmate shared a car or shared an office space, and that was the reason for transmission in that case. But I'd be guessing downgrading to Tier 2 is often based on that first flush of tests that come back for everyone, and an understanding of what the interactions between everyone on those work sites might be, and it's obviously been deemed a lower risk. It'll be reviewed all of the time, and if there are further positive cases, it may well be upgraded again.
There are workers who are concerned that that a Tier 1 grading would have had a huge impact on the project. I think the Frankston rail line was due to be closed off as a result of this soon. Are you able to reassure the public that this would have been based on the infection risk and not the risk to the project?
Yeah, it's always based on the infection risk in terms of the public health designation of a tier level for any exposure site.
How does the antibody treatment work? Is it a blood transfusion? Is it a nasal spray?
Yeah, you get an infusion. You are hopefully able to remain at home. So the infusion happens over a 1 hour period in an outpatient setting, I imagine, or a day clinic setting, and you can stay at home, and it protects you from that more severe illness. The antibody works by attaching, as for any immune response, attaching to the virus and neutralising its effect on the body and on the cells. So a really positive development. There are over 7,000 doses that have been acquired, procured for Australia. There are 500 available in Victoria as of now.
When do you think that's going to be widely available? Obviously, you've got to test to see if it works. Is that something that in 6 months' time there might be a treatment if this is successful?
Oh, look, it's already in the treatment category, so it's gone through approvals internationally and in Australia. It's now really in the consolidation phase where it's given to patients, and we continue to monitor the clinical differences that it makes by virtue of being given.
And does that give you more options for removing lockdowns if there is a treatment and there is vaccinations?
Oh, it certainly gives us an assurance that our health system can be protected from those more severe cases that would otherwise require intensive care. So anyone who gets downgraded from dying to surviving, absolutely a worthwhile treatment, but also from intensive care to being managed on the ward or not requiring admission in the first place, they are all positive things with this particular treatment.
Can I ask a follow-up question that's not COVID related, if that's okay? There are serious allegations of domestic violence and assault against the head of an ALP-affiliated union.